Okay, Assalamualaikum warahmatullahi wabarakatuh. We will presenting about the case 3, ethical decision from case 3. We are Kireii, Larasati, Hartoyo, Lutfia, Ainna, Shafa, and Lutfiyatul Mutawadingah. This is case 3. Ethical problems in case 3. Ethical principle and ethical issues. Okay. Ethical principle. What are the ethical principles involved? Veracity. And ethical issues. What are the types of the ethical issues happening? Truth telling versus deception. Next is the problem statements. Mr. Green is a 57-year-old gentleman with aggressive prostate cancer who was diagnosed 7 years ago. On the last admission, Mr. Green was told that he may only have 4 until 6 weeks. Previously, it was 6 until 12 months to live after a cystoscopy showed further extensive growth of the tumor. Mr. Green pulled one of the author's colleagues aside and confided to the nurse that the plan to kill himself and that it was a secret that the nurse was not to tell anyone. There are 11 facts. What are the facts gathered from the case? There are 6 relevant facts. 1. Mr. Green is a 57 years old. 2. Mr. Green was diagnosed with prostate cancer 7 years ago. 3. Mr. Green refused medical and surgical treatment 7 years ago. 4. He chose to seek alternative treatment and did not follow up with the urologist over that 7-year period. 5. Mr. Green has now presented with anemia and hypoproteinemia. 6. The cancer had metastasis to his bones. It had spread locally to his lymph nodes, and the primary tumor was invading the bladder and partially obstructing the left kidney. Stakeholders and the concerns. Who are involved? What do they concern? Patient. He wanted to give up on his condition after doctor predicted his life would not be long with suicide. Nurse. Nurses must provide understanding to the patient that suicide is not the right choice. We found 3 options from case 3. What are the possible solutions? What are the advantages and disadvantages of each option? 1. Tell the patient family that they want to encourage the patient to stay alive. 2. Advise the patient to inject euthanasia as an option to end the patient's life. 3. Patient need to be moved to the hospital in order to get more appropriate treatment. In option 1, tell the patient family that they want to encourage the patient to stay alive. Advantages: patient have support system from his family. Patient has someone who look after him. And disadvantages: maybe patient doesn't want his family to know about his condition because it might burden his family. And then option 2, advise the patient to inject euthanasia as an option to end the patient's life. Advantages: patient doesn't feel severe pain anymore. And disadvantages: in Indonesia, euthanasia is illegal and the health care team might get punished. Violates the rules of religion for killing. And last, maybe the patient can live longer than the doctor predicted. Decision and justification. Decision. What is the recommended decision? Decision from case 3. The patient needs to tell his family about his current condition, and if his family is unable to treat the patient can be transferred to the hospital to get palliative care. Justification. What are the considerations? Although the doctor predicts the patient's age is not long, but the patient should not end his own life, there is still a possibility that patient can live longer than predicted by doctor. Okay, this is the presentation from our group. Thanks for your attention. Wassalamualaikum warahmatullahi wabarakatuh.